Coming up on this episode of Common Denominator.
We beat cancer every day. Every single person that can understand, like have lived long enough to hear things, has beat cancer. There's no doubt about it. Why? Because of our immune system and our patrol system and our surveillance system is beating cancer constantly. When it sees something sketchy, it kills it.
Hi, and welcome to Common Denominator, where we shine a light on people striving to make the world a better place. Today, a nationally recognized oncologist with strategies on cancer prevention, detection, and treatment. Dr. Sanjay Juneja is a triple board certified hematologist and oncologist and the Chief of Oncology Service at Baton Rouge Hospital. He'll tell us about the incredible game-changing developments in the cancer world and if we're closing in on a cure. Plus, we'll discuss holistic ways to prevent and treat cancer, including nutrition, mindfulness, and self-care. Just finished an amazing conversation with Dr. Sanjay. And the thing that stuck out the most was that his open-mindedness to the science and the data combined with a spiritual practice and mindfulness. Before we play that chat, a quick reminder that if you like the show, please subscribe and follow me on social media at Popack. Now, here's my conversation with Dr. Sanjay Juneja. Enjoy. Hi, Dr. Sanjay, and welcome to Common Denominator.
Thank you. I'm excited to be here, and thanks for doing this.
For sure. Recently, first of all, it's an honor and a pleasure to have you here on the show. And I know that recently I've been reading in the news as a layperson, there seems to be a lot more optimism in the oncology space. Why is that happening?
The thing you're probably talking about is this whole concept of like targeted therapy and novel agents and precision medicine. And the reason people are excited about it is, remember, cancer, the hardest thing about cancer is it was a normal cell, right? So you have these like billions of cells in your body, and you don't know which one's going to go rogue. And I think we're going to talk about that later, why lifestyle stuff makes a difference. But when it goes rogue, it basically uses a tool that is in all of our toolboxes and just starts using it in a bad way to grow and not stop. So it's very hard to predict, right? So when people ask, like, how are we just going to make cancer go away? That's a challenging question. What could happen is when we know exactly what tool is making it grow and making it so bad and spread, if we can attack that tool with targeted therapy, precision therapy, novel therapy, like HER2 positive breast cancer, right? You never wanted that before we targeted it. It was terrible. It was like the thing you prayed you didn't have. Now you wish you had that instead of being negative for everything in breast cancer because you have no targets. And that's standard chemo, just shotgunning poison and hoping the cells that replicate the fastest get poisoned the most while the rest of your body takes an insult. That's way different. That is the traditional chemo cytotoxic therapy, which we use a lot of, than saying, I'm going to go hone in on HER2, that thing that makes it really terrible. But now that I have a mutation, I actually hope or a treatment, I hope that I have it because I can melt it away faster. And so I think that's the excitement, is like we're going down from not just the cell level, which is just a shotgun approach. Give chemo, it replicates fast, it's going to get all messed up and die. That's standard cytotoxic chemo. Still works very effectively. But we're going to more precision, which is, what is the very thing? Is it the black hat that says whatever positivity? No, it would never be that. What are you wearing? But whatever that is, can we go attack that rather than just this shotgun massive kill approach?
And just so in general, like the approach, right? The chemo radiation approach, just what are the stats? Someone will get cancer, and that regular protocol in the U.S. system of chemo, 5 years later, like what are the stats, and why is this a much better approach statistically for people to survive and thrive?
So that's the key thing. Like no two stories are the same, and that's important for anyone that I get a lot of messages on my social media, my DMs, like, I was told this by this person. Why am I getting this person? And it causes a lot of anxiety, right? It's like, why am I not being treated the same? Everything is treated differently. The basic principle is the same, which is, in general, stage 1 to 3 is in one place. It ain't gone anywhere yet, or at least from what we can tell, because it takes like 100 to 300 million cells all packed in one place to see it on a CT scan. So people are like, well, I was told I had no cancer and it came back 6 months, 8 months later. Unfortunately, it's because we couldn't see it. Like you need enough of these tiny little cells to see them, right? So stage 1 to 3 generally is curative in the sense of take it out. Ideally, you take out any rogue colony of cells. If you have melanoma or skin cancer, what do you want to do? You want to take it out. Obviously, you don't want to dissect the whole hand if you can help it, but you want to take out everything and then everything around it that's good cells just to make sure you got it. It's the same thing in anything else: breast cancer, lung cancer, colon cancer, liver cancer. If you can ideally just cut it all out, then that's the best case scenario. It's like a stage 1, and a lot of times you won't need chemo. The reason we recommend chemo or radiation for stage 2 and 3 generally is because we know that when you watch the patients, that a certain percentage still had persistent disease. I don't like when people say it's a recurrence. It ain't a recurrence. You had that thing, we just couldn't see it. And then when we make a decision to say, okay, give chemo or radiation, we look forward and say, do the same amount of people recur or have this persistence that declares itself? And if the answer is no, 20% of people have less of a recurrence, it's because you poisoned the cells that you couldn't see when you thought you got it all. But you know they're there because 40% say have a recurrence, right? Or a persistence. And that's how we have our data. We say this shows a benefit of X amount. That's why you want to ask your oncologist, what percent benefit do I have of avoiding this, that reducing the chance of me showing this thing later. And that's what radiation and chemo both accomplish, is to kill cells that may be remaining that we can't see.
And what about the other effects? Are there side effects? Just for knowledge for people, what do you see the side effects of chemo and radiation in the patients?
So for radiation, it's radiation doctors will get mad at me for saying this, but it's basically like glorified sun rays to a degree. It's like if you lay it out too long, you get burn. Radiation is usually in one place because it does damage the cells or stun them around the area. But it's basically just nuking that nucleus and that DNA. When it replicates, it just melts away. And so you're going to have that, and then you're going to get the effects of what was after a burn. So if it's in the prostate, it's a little scary of an area, or in the head and neck. Are you going to get your salivation back? Are you in the prostate? Is it going to mess up your bladder? But that's different than sometimes to the breast, especially not on the heart side. You're just getting overall, radiation to that area. It may be hot and tender and stuff towards the end of it. Just the longer you stay in the sun, the worse. But in general, it's not going to have that, the same degree of concern as a prostate for hitting the bladder, because there aren't any major organs there. With chemo, it's a whole host of things, we have obviously several types of chemo. We know some work better than others, but in general, your bone marrow is the thing why you want to get blood counts, because you don't want to have screwed up that garden too much to make the fruits and vegetables you need: blood cells, platelets, white blood cells, neutrophils. Sometimes you can see with a lot of chemos that gets all messed up. Why? Because it replicated fast during the chemo treatment. So did your hair. And so you lose your hair, and usually you get it back. The things that replicate the fastest generally get injured the most. Why? Because that's what we're trying to accomplish with the fast replicating cancer cells. And that's why people get nauseous and have diarrhea and have skin changes. Those are the things that replicate the fastest. All of dust is skin and hair. And so you see stuff during chemo with that, but you hope that a lot of that stuff is recovered because all those cells die away. You have new good cells, and that, hopefully everything is manageable.
And where do you see, let's just say, all these new exciting movement that's happening in the space? Where do you see the oncology space being, or cancer treatment, in the next 5 to 10 years? Where do you think we're moving to?
Let me start by saying the most ideal thing is that, like I said, just like you want to take it out when it's this big and not infiltrating your entire thumb, the most ideal way we beat cancer is catch it when it's extremely early, right? Other than preventing it, which I guess we'll talk to. But if you can catch it super early, that's the key. Now, I already told you it takes 100 million cells to 300 million to see it on a scan. And obviously it would cost a ton and have radiation, exposure and all this to just scan everybody all the time. But if you didn't want to have cancer and you got a full body MRI and blood work every single day, right? You'd be much more likely to catch a cancer. Granted, it would take 7 hours every day early, because MRI, sees a little more defined than the CT scan. But where we're headed is catch it earlier. And you might say, well, do you mean mammograms and screening, this and that? Sure, that helps. You're still waiting for the mass to be big enough. But we're starting to be able to, you've heard about this Gallery test and all this stuff. These are ways that we're looking at, can we detect that something is messed up meaning I know this is the feature, this is the blueprint of the house that breaks down. You don't want to build that house. When you start seeing it in the blood circulating, it tips you off. Hey, this is a defective blueprint. It's coming from somewhere, and maybe you can catch it earlier. And then on the flip side, the treatment wise, other than being able to take it out or remove it, it's just more and more targeted. Can I do less of a shotgun? And can I target things that are not as present on my normal cells? But it's difficult because remember, the toolbox of that cancer is the exact same with the same tools, the same hammer and wrench and everything else as your normal cells. They didn't invent a tool per se, right? For the most part, they're just using them in a defective way or in a neoplastic aggressive, way.
And I know I've traveled a lot, and I know that the protocols, let's say in more, I guess the balance, is there a balance between Eastern and Western cancer prevention, cancer treatment, or do you feel kind of how we treat, let's just say compared to, let's say, some places in Germany or in Asia, that kind of how they treat cancer, I guess more holistically, is there some balance? Do you feel we do it correct in the U.S., or is there some balance between the two?
So that is a 12 series podcast, but I love that question. And that's what I try to do with mine, with Target Cancer Podcast, because I'm a traditional oncologist, so I can tell you what the guidelines are. I can make sure I'm doing it correctly on what's approved, what's insurance covered based on data, right? There's one way to do all that. Then I have a bunch of, people or guests that are just kind of leading the thought on how things work. And it's humbling. And it'll take a long time to come back to it, right? To be the standard of practice. But I just had, for example, Jason Fung, he wrote the obesity code, the cancer code, diabetes code. People like him strongly believe that it's not even necessarily like the being overweight or having diabetes is the issue. They believe it's more so the fact that using insulin when you're having to use it for being diabetic and usually overweight, insulin is a growth factor, right? It is a growth factor. We know that. If you don't have insulin, you're not going to grow and mature in a proper way. If your body's having to do more and more and more and more of this, grow, what does cancer stand for in Latin? Unregulated growth. That's the problem, is when cells are pushed to just start growing without. So, they've looked at studies where they say, okay, these people that may be overweight to the same degree but don't have insulin resistance, even that's a debated term. Do they have as much of an incidence of cancer? And it looks like not as much. And so there's that whole element. Do we have diets that's just subjecting us to such ridiculous degrees of circulating sugar that our body's like, bro, I don't know not enough signal will make this go away. I have to store it, I have to stuff it into your liver and all this stuff. Then there's this other element where some people believe is purely just metabolic issues. So it's all these things you hear about meditation and, cold showers, even, for example, and calmness and relaxedness and chilling out and exercise. A lot of people believe all that's the same principle that's happening, and that it stimulates your parasympathetic Zen, state of being. Parasympathetic and sympathetic are always like this. It's always one or the other, and it's a dial back and forth. Sympathetic is stress, flight or fight. It's the stuff that you do in a crisis, but it doesn't have to be a crisis. Parasympathetic is vagal nerve stuff. This is all chill. The blood pressure doesn't beat as hard. You don't get as much arterial damage. You don't get the inflammation that comes from arterial damage. You don't get the headaches. So a lot of medicine in the East, both for preventative and also as part of it, is to say, can we tap into the stuff that we know doesn't accelerate or cause extra stress hormone? Can we, people always say, well, is there something I could take to just fix the cancer? It's extremely challenging because I told you that cancer cell is your normal cell. There's no doubt about that, or was. And so how do you deprive yourself or take something that doesn't necessarily hurt your own cells if it was a rogue version of yourself? However, there are people like Siddhartha Mukherjee, Pulitzer Prize winner, wrote Emperor of All Maladies. If anyone's interested in cancer, to learn it, you read it. He thought as a thought leader, a lot of people are believing there's certain amino acids you could take out from your diet and that they will help make the pancreatic cancer and other cancers just not have the fuel it needs. Select ones, and it's not for everybody, but that goes back to precision. Which ones are the ones you need to take out? And lastly, a lot of people do believe, and I'll say that diets that have low glycemic index for the same reasons I mentioned, when they look at villages and populations in the world, these people almost have like no incidence of colon cancer and very, very, very little. You transplant that person with the same genetics to America, and all of a sudden the rates come up. So it's definitely, I think, unquestionably a lifestyle, diet, exposure, inflammation related thing. And I think most people would agree with that anything inherited that protects you from cancer. Only 10% of cancer is from something you got from your parents, inherited. 90%, 85 to 90% has nothing to do, as far as we know, with what you were inherited with, and has to do with what were your cells exposed to over the course of your lifetime in your body.
Yeah, because it's interesting. It was a little bit forward, but I went to a concert. I went to the One Republic concert last week, and there was an opening. Yeah, amazing. By the way, great performance. And the opening band, the last song, she brought her friend on the stage. And again, I'm a lay person. I'm watching this, and she says, the doctors had told her, this friend of hers, that she had an 87% chance of getting breast cancer, and she's like, oh, she took her life into her own hands, and her body into her own hands. Basically, she gets on stage without a shirt, and she had removed both breasts. And I was like, okay, I don't know what to make of that, and I was excited to be talking to you about that. What's your thought about it? A doctor says to you, you don't have cancer yet, but your family genetics are showing that. And for a female, right, it seems to be a very tough decision. So
it is. And you hear about celebrities with this decision a lot. And what you're talking about is called BRCA mutation, BRCA1 and BRCA2. Those are mutations, BRCA1 and 2, that we know are linked to cancer, right? And so if you look at all breast cancer, still 85% of people don't have anything to do, they don't have that mutation. But the 15%, both BRCA1 and BRCA2 are mutations that we know they basically like make the setting. And in this case, it's because they have trouble, basically repairing the DNA damage that happens over time. So statistically, if you don't have one of your repair mechanisms or something that basically it's a little complicated, but if you know that one of the gazillions of ways our bodies protect us from cancer every day, if one of those things doesn't work, like the laser on a security guard or the gun, you already know that gun doesn't work, then you know that you may be in more trouble with that, police officer or that security than somebody where that guns are operational. We beat cancer every day. Every single person that can understand, have lived long enough to hear things, has beat cancer. There's no doubt about it. Why? Because of our immune system and our patrol system and our surveillance system is beating cancer constantly. When it sees something sketchy, it kills it, right? And we're doing it all the time. 10,000 mutational errors a day we have. We're a bunch of ingrates because we never thank our immune systems when we go to bed. But it's crazy how much regulation our bodies are doing all the time. The thing is, and that's why there's all this talk about immune cells and how do I use immune therapy to get my body? Because you're going back to the basics. This cancer escaped your immune cells. If you're at a bar and you're drinking underage because you got a bracelet that says you're 21, it's how would security know? You got the bracelet that's a 21-year-old. You've escaped security, but it doesn't mean you're not not doing something illegal. And so the question is, how do we get back to identify those people that are 18 years old with a bracelet that just says? And that's what immune therapy is. How do we re-enable what's already there to go see it and kick it out, the bar or whatever?
So you would be a big supporter of immune therapy, because I know our homeschool teacher had her sister, and she went, and there's this certain treatment that she said, this is what she was telling me, that she went to Tijuana, and obviously it's not approved, I guess, in the U.S., that they have certain oncologists or that practice right, south of the border, and she had tremendous results. Some immune therapy, I think something like that. But that was an interesting thing. But you believe overall that the way we're handling cancer in the U.S. today, our stats are getting better and better over time?
Oh, there's no question. I mean, people are living much longer now than there's so many things that we knew people lived weeks to months that people can live years now. EGFR positive, that's a mutation in lung cancer. Now we have an oral pill that has a good chance of controlling it. But anyone listening to this, I want to make sure immune therapy is a very broad concept. You don't go online and just buy immune boosters, because immune system can do good and bad. And you got to know exactly, there's so many, dozens and dozens and dozens of different cell types and everything. You got to know what you're boosting and where was the thing that made that person with the bracelet escape. In this case, it was the bracelet. That's a specific immune cell, right? Everyone talks about immunotherapy with PD-1, PD-L1. That's one example. But immune cells, boosting them can be bad too. I mean, that's what autoimmune disease is, right? Lupus and rheumatoid and all this stuff. So you have to be very careful. Basically, medicine is humbling. Everything we know, it's like, oh, like we finally got it. It's like, oh my gosh, there's like 10 different elements and these levers actually do different things. It's like that movie you're watching and you're just like, they broke in, and all of a sudden you find out it's like an inverse relationship or not. It's just, the more we learn, the more humbling it is. And in a weird way, I think philosophically, it's like we're trying to combat the exact thing that made us, like at the end of the day, because we have these tools and escape mechanisms and second and third lines of living through, if you believe in evolution, through evolution. That's how we got here. That's how we can sustain life. But when one of those same things that got here over thousands of years and all the tools and properties, we as humans are like, well, how do we undo that? How do we undo the very thing that's like literally fostered our very existence to this day? And that's a tall order.
If you're just joining us, you're listening to the Common Denominator podcast. My guest is Dr. Sanjay Juneja, a triple board-certified hematologist and oncologist and the Chief of Oncology Service at Baton Rouge Hospital. Next week, I'll speak with Justin Richmond, the host of the Started from the Bottom podcast. On his show, Justin interviews successful people who grew up as outsiders and beat the odds while overcoming imposter syndrome, which is something Justin, who was once homeless and a high school dropout, has overcome himself. If you've ever felt like an outsider or struggled with imposter syndrome, this episode is for you. Make sure to subscribe so you don't miss it. Now, back to the show. I always hear of people, talking about like kind of early detection. How important do you find that?
I mean, it's super important. So again, the example with the skin cancer early, if you just let it ride, right? And it's like, at first it's a pigment, but then it's like bigger and bigger, and it's the size of your palm. And, your buddies are like, bro, you should get that checked out. And you don't. And then it's now starting to get ulcerated. Like, obviously, if you did it when it was a freckle, if it was cancer, then you've avoided it going into your soft tissue, it going into your blood vessels, it probably jumping on the highway and going somewhere else, and you don't know it. The sooner you catch it before it develops properties to escape, when it learns, that's the thing that people, like, I think also don't realize. That cancer that you have, especially if it's big or if it's elsewhere, it's a whole bunch of different types of cancers. It's like if we had COVID, alpha, beta, zeta, epsilon, all that stuff, if we all had it at once, that's what big cancers are. And so if you can catch it when it was just COVID, if we could have killed COVID when it came out right at the beginning, all of it somehow, then we wouldn't have Delta and all these other Greek letters. But when you can't kill it like early, it's when it evolves. And then that's where it gets challenging.
And then I always think about prevention. I mean, from that perspective, what would you say top 3 or 4 things that us as humans can do prevention-wise?
Number one, there's no doubt, and I didn't understand this at first, but the whole thing I was alluding to earlier, processed foods and things that are like high glycemic index. Like, I love like a honey bun, right? It's like, I had one at the airport the other day, but it is just absolute crap. Not just in the sense of, the calories don't pack on muscles. It is everything that you should not be consuming, like because of the inflammation, because of the wires that usually are used to you eating pears and fruits and going around the farm with your, leaf made clothes. All of a sudden you inject it with this super high toxic dose of processed foods. All of those things foster a setting of things going awry. And so, like, there's just no doubt fruits and vegetables help. Like, there's no doubt the antioxidants, the fiber, even that's a little debated, all that stuff is good, right? Coffee, believe it or not, helps. It helps a lot of things, like cardiovascular disease and everything. It can be decaf. It's not the nicotine, and it's not the tons of sugar you put into it, but just coffee alone, there's many studies that show people have less incidence of like strokes and heart attacks and all this stuff, and potentially cancer than the people that never drink coffee, right? And it's not the nicotine. So those are important. And then I hate to say it, but anything that stimulates that vagal, parasympathetic, like, this is kind of more anecdotal, right? It's not a standard recommendation, but like meditation, cardiovascular exercise definitely does help. But all of that stuff the more you do it in a day, even if it's 10 minutes, like 5 times, that's better than 1 hour only 3 times a week. You just want to continue to inject your body with chill, calm down, less inflammation. And then, things that cause cancer, like HPV vaccine keeps you from getting HPV, which we know is 90% of cervical cancer. So if everyone gets HPV, then all of a sudden 90% of cervical cancer goes away, at least those types. And so there are those kind of like, interjections that we use. But for the most part, I want everyone to know you could try to avoid it, but it's really bothered me. I learned about it on social media. People like want to blame fault for somebody for having cancer. I will tell you, and shouldn't have to tell you this because it's just a fact, but I've seen yogists, I've seen people that are so, it's like, that's where it's humbling about the world. The world can appear unfair. There's just things that happen, but this is an error problem. You can change the dial of how many errors you have and how much you want to get away with, and you can dial it down. But at the end of the day, if you exist, you duplicate and you have errors, and your immune system does a pretty good job of keeping it under control. Don't do things to accelerate that. I like to have a nightcap, like I'll drink like bourbon, scotch, whatever. There's no question alcohol's not good, like for cancer. I wish it was. I wish red wine or something, but it's not. Why? Because there's injury. It makes an environment. So it's like most things in life, right? Like the more we learn, and really how we started this episode, the neurocognitive shield, you can be debilitated by like all the possibilities of XYZ. Larry David, for example, I love him, right? He wrote Seinfeld. Sure. He's like apparently neurotic. But I mean, we know this, his character was Costanza, but with his diet and eating. And so you just find where you are on the scale and trust that, everything else kind of has a place and setting, and like flying or anything else.
Do you think that, like when I look at the curriculum of medical schools, do you think that they should have more focus on diet and exercise? Because it seems like,
oh my gosh, we are very bad about that in this country. Like we're very behind. Yeah. Some people argue that it's because it's not profitable. You don't make money by spending time in a clinic visit, whatever. What I've learned, if anything, over my 14 years of this whole medical tract is everything is to some degree partly true. Like it's like when we start trying to make it binary and polar, we go against ourselves. And that's the problem. It is multifactorial. We're complex beings. We're complex beings socially, in our behaviors, in ourselves. We all grow up. The more we can just accept that something may be true and not write it off, and then at the same time say, but that doesn't mean all of it is. That's how the collaboration can happen. And that's my biggest concern. Like, you can see it in cancer and pharma and healthcare industry, but you can see it in all kinds of other stuff too, right? Politics and social behaviors. It's just like, I think the overall common denominator to make sure that things go okay are just like collaborate, listen, accept that you can learn something from basically anyone that you don't know. And you can carbon copy and duplicate that to everything, socially, science, like cancer, like, technology, if we just all collaborated.
Surrender and acceptance, right? That's kind of the idea. A friend of mine's wife is an oncologist here in Miami, and he was telling me the story the other day. It's like he told their family that their father only had, a day or two to live, and this doctor went to lunch with the patient, and then the patient passed the next day. And I think, what is that experience like for you, right? You seem pretty well-rounded and pretty spiritual and knowledgeable. How do you deal with that?
Oh, it's hard. I mean, my wife and I are both oncologists, and so we share stories. She probably cries more often than I do, but it's still not without tears, because we take care of people, for sometimes years, see them every 2 or 3 weeks, know everything about them. I think at the end of the day, like, I'm getting goosebumps when you ask that question. It's just like, and it goes again for anything in cancer outside of it. Are you doing the most for the people around you? And doesn't necessarily mean treatment wise, but knowledge wise, care wise, concern wise. Like, leave nothing on the table. I made this post the other day, which is weird, but I had a James Dean poster that said, dream as if you'll live forever, live as if you'll die today. And I was thinking about it, and I was like, I don't know that I'd live as if I'll die today, but I do kind of, being my field, live as if I'll die in 6 months. I always have a 6-month plan. What can I do in those 6 months? And obviously a lot of that becomes be kind to others, appreciate every moment, and do the most. And at the end of the day, if I could make someone feel loved at the end of their time, if I could make them know that they were supported, considered, not a number in the clinic or whatever, like at the end of the day, the rest is, celestial will. But do you feel at peace about the variables that could be controlled? Were they optimized? And if you feel that way, if any of us feel that way, right, at the end of our lives or time, I think the next, I think that's the easiest way to go to whatever's next.
Yeah, no, and I think it's a very unique approach. I know you have, very popular Instagram account, the Onc Doc, and you instill humor into, it's a pretty serious topic. And what gave you kind of that idea? Because I do actually believe in that.
Oh yeah. And, I think the humor bits are more like individual knowledge bits, but working at the VA, as I had veterans in kind of northern Louisiana for a long time. I see a lot of people that live, can be very successful and everything, but just live, in a very far distance in their minds from what cancer is and how it can be treated. And then I would see these same patients, a woman that was 90 years old and just quiet and I could tell she was scared. Later, I found out when she got educated, she's vibrant, she's high-fiving, she's cracking jokes. And it's because nothing's changed. I haven't changed the disease. I haven't changed if it's incurable. But you see a switch flipped, and I see it all the time. And I think any oncologist can say this, that teaches. You see what can happen in a human being, like the courage and the strength and the ability. That's what's so humbling. People are like, it must be hard to be a cancer doctor. How do you do it? I'm like I could never do it. I'm like, it's humbling. Like you see what you can unlock in anybody. And I think a lot of it is education. Education is easier to receive sometimes with humor or with like whatever, never like humor about the case itself, but at least about like something that's happening. And then it's almost passive. It's like, well, I didn't want to learn anything about cancer, but I did. And then therefore, it's that security. It's like opening your eyes, like we're having a light in the cave that makes that cave or room much less scary. But the light is learning. Because if you're just hearing things here and there, it's frightening. And I see that all the time. And I get a lot of posts about it. And I wish I could, respond to everybody. But I'm like, the best thing I can do at least to like give lights. Here's a light, here's a light, here's a light. And we can all do that. We can all share that about, again, cancer, not cancer experience. Again, we could just light up the world if we all just like decided to light our own candles instead of, trying to blow out others and being like, I don't like the tone of yours. So I think it's all goes back to the same thing.
Big believer in that. And kind of in that vein, what is something that you're truly grateful for?
Oh, give me chills again. I think more than anything, I'm very grateful for, now you're gonna be choked up, but it's like, my wife and my parents and kind of the love I was shown. And then I'm also very grateful. I have a tattoo of Louisiana and they're like, why? It's a poor state and it's, thought of as not receptive to Indians, and my community support me, but especially my family, my wife has taught me a lot of virtue and growth. And it also makes me realize people don't get that. So I just think I'm so humbled when people like didn't have those figures in their life. But for me, an opportunity to have someone that loves me, and then, was my parents and my brother and my wife, that alone makes me more grateful for anything that comes in my life, because there's no way I would have done that without them in my community. Like I'm just a file cabinet of my experiences and shared wisdoms. Like I had nothing, right? I was an empty file cabinet. And I think I will just never stop being grateful for that. And I will never think that something I've done is like I did it. Everyone else did it. I'm just the collection of it all.
Well, your gratitude exudes your energy, so it's really forward. So it's out and obvious. So I appreciate it. I appreciate that and continue to stay that way. What is something about you that people don't know?
Oh, something that people don't know. I think a lot of people are surprised I used to be like pretty into boxing and Muay Thai and all that kind of stuff. That, because I'm very gentle, but then like, we use the example of like being desensitized. I used to use the example of when you first get in a ring and you see that first punch coming, you're always going to overcorrect and you get lopsided basically. But the more you're used to seeing the fist come, like that's to me is like understanding, like knowledge. The more like desensitized you are, the better it is. The other thing that people will get surprised by, this was yesterday, is how I can be so science-based, but then I very much believe in like just, I don't know if it's cosmetologically or astrologically, but I do think there is some crazy web of harmony and humanism and virtue that exists everywhere, and you just have to like perceive it to like ride that wave. And I think that's a very unconservative, kind of unscientific, at least, thought process. But it's definitely guided me to, like I said, the blessings of my life, like my wife, my career, my patients. Yeah, those would be two surprises for a nerdy science guy.
I share that view, by the way. So my mentor said that one day, that kind of spiritual world and science will merge. That was like his. It was like kind of like the grand rabbi. That was like his.
Yeah.
And I see that. I see, as you're saying, right? So science, compared to 10 years ago, 20 years ago, 30 years ago, keeps evolving. Quantum mechanics, ideas, right? Like nanotechnology, we keep going. I think it's tremendous. But Doc, I really appreciate, spending the time on the show with you. And if people want to hear you on your podcast, follow you on social, how would they be able to do that?
Yeah, so I post predominantly on Instagram and TikTok. It's the Onc Doc, ONC, the Onc Doc, all one word, DOC. And then my podcast, if you're really kind of a geek, is Target Cancer Podcast. It's on Apple, Spotify, YouTube, and then I have a Facebook page, Sanjay Juneja, MD. But yeah, I try to just disseminate, the most I can, and that's why I appreciate you all. And it was an immediate yes for me, and excited because I love the concept of the common denominator. Like, I think commonality is something that we just either don't want to believe in, forget to believe in, but it's very palliative. It hits that vagal parasympathetic thing that I talked about when
Correct.
You just realize the commonality rather than the polarity. And so I appreciate everything y'all are doing and sharing all those things to make that happen.
Well, thank you so much, Doc. Really, it's been a pleasure, and only blessings. Thank you.
Likewise. Thank you.
Hope you enjoyed my conversation with Dr. Sanjay. Next week, I'll speak with Justin Richmond. Justin hosts the Started from the Bottom podcast, where he chats with successful people who overcame imposter syndrome and sometimes still struggle with it. You'll hear fantastic advice on how you can thrive in any situation, even when you feel like an outsider. Please subscribe to the show so you don't miss an episode, and follow me on social media at @Popack. Have a great day, and I'll talk to you again soon.